Hey there, welcome to the show. A common issue our perimenopausal clients deal with is low libido. You may have little to no desire, don't enjoy sex as much as you used to, and it can really impact your relationship because you feel guilty and disconnected. So let's talk about it. So, libido is your sex drive or your desire for sex, and it can vary from person to person. It can fluctuate over time, and there are many factors that impact it. Now, conversely, some women notice an increase in libido in perimenopause because your ovaries are having kind of like a last hurrah, spiking estrogen, progesterone, and testosterone before they eventually decline. So you may have a day or a month where your estrogen is high, another when it's low. Same with progesterone. Ovulation is very spotty. So some months you may ovulate and make some progesterone, other months you won't ovulate, so you won't make progesterone. And testosterone also can be up and down in this stage of life because, like I said, your ovaries are just trying to get a little bit more of those hormones because they're so important, but eventually they will be declining. So, since low libido seems to be more common, let's dive into that. The first major reason for low libido is declining estrogen. So, estrogen is responsible for so many different things in the body, including the blood flow to our genitals, and it keeps the tissue in that area nice and lubricated and sensitive. So, when estrogen level starts to drop, vaginal dryness can occur, making intimacy, of course, really uncomfortable or even painful for a lot of women. And of course, that can put a damper on your libido. Another factor is the decrease in testosterone, which I just talked about a little bit. So, yes, we have and need testosterone as women. It's a really, really important hormone, and it's a key player in maintaining that desire. So, as we transition through perimenopause, our testosterone levels start to decrease, and that's going to contribute to the low interest in sex. The other thing is low progesterone. A lot of people don't think of low progesterone and low libido. So, progesterone has a very calming effect on our brain. It can help reduce stress, anxiety, and of course, sleep. So, when progesterone levels starts to drop, it can lead to that increased anxiety, irritability, mood swings that so many women are dealing with in this stage of life, which of course is going to completely tank your libido and you're not going to be in the mood for intimacy. And if you're not getting quality sleep because of that low progesterone, you're going to feel exhausted and that is going to tank your libido. So, progesterone also helps to regulate estrogen's effect, right? They work in tandem with one another. We need both of them, but we need progesterone almost to calm the stimulatory effects of estrogen. And that's going to help regulate, or progesterone is going to help regulate estrogen's effects on our tissues. So, when progesterone is low, that balance between estrogen and progesterone shifts, and that's going to affect your lubrication as well as blood flow, and that's going to make arousal much more difficult. So, obviously, hormones play a huge role, but like I have said many times before, it's not just about our hormones. There are other things that contribute to that low libido. So, the first thing, of course, is fatigue, and that is very typical in this stage of life. Yes, because of the hormone shift that is occurring, but also because of the very, very busy lives that we lead. Most women in their perimenopausal years, they're raising kids, they're working full time, they're maintaining a home, and they're also caring for aging parents. So it is a lot on us. So no wonder why a lot of us are fatigued and just not in the mood for sex. The other thing is chronic stress, okay? And that's going to cause dysregulated cortisol. I've talked about stress on previous episodes, so go back and listen to those. But when our cortisol is consistently elevated or it's dysregulated, meaning it's really low in the morning and high at night, that's not a good thing, right? We need to regulate or reset that cortisol pattern, if you will. Your body is essentially in fight or flight mode all the time. And that just means that your body is like, okay, we need to keep this person alive. Nothing else that you want to do is going to happen. Okay. Including, of course, intimacy, but also making sure you're losing weight. You want your hair to grow, all the things. But if you're stressed out all the time, all those major functions are going to be slowed down. Depression is another one, right? When we're depressed, of course, we're not going to be in the mood for intimacy. And this is very common in this stage of life, again, because of all the things I've mentioned so far, but especially the drop in those hormones like estrogen. Estrogen really affects your mood. The other thing to consider is poor circulation or just reduced blood flow. That can impact your arousal. Medications are another one. Antidepressants, hormonal birth control, blood pressure medication, pain relievers, or opioids, antihistamines, which so many women take, or even PPIs, which are antacids. A lot of these things are really common in this stage of life because symptoms start to creep up due to low hormones or gut dysfunction. So you go to your doctor, and of course, they're going to give you something to fix it. And I don't blame you for taking those things because you want some relief, but know that a lot of these medications can absolutely affect your libido. And then there's something to consider, which is elevated prolactin. So that is a hormone, but hopefully you don't have a pituitary adenoma like I do. But that was something that I noticed. My libido started to dip years ago when I eventually realized that my prolactin hormone was sky high, and then was eventually diagnosed with a prolactin producing microadenoma or benign tumor that sits on the pituitary gland. They're actually much more common than you would think. And of course, a lot of doctors aren't testing for them. They're not looking for them. So, if you're already addressing all the things I'm talking about, and next time you go get some blood work done, it may not hurt to just add prolactin to that lab requisition just to see what your level is. The other thing, of course, is thyroid function. If your thyroid is not functioning optimally, it will affect your libido. It will affect everything, right? I've talked about this. If you haven't listened to my episodes about thyroid health, make sure you go back and listen to those. All right. The other thing is disrupted circadian rhythm. This is so common nowadays with technology. How many of us are waking up in the morning and grabbing our phones and looking at a screen versus going outside and getting that natural light in our eyes? This is going to really disrupt that circadian rhythm. So getting as much natural light as you can, especially in the morning, is going to be really beneficial, and really minimizing the blue light or artificial light. Imbalanced blood sugar is another thing that can affect your libido. And again, super important. I've talked about diet on previous episodes, but so many women in this stage of life have imbalanced blood sugar, and that can lead to insulin resistance. It's really common as we lose estrogen, as our cortisol fluctuates. So your diet is super important. Another is feeling disconnected from your partner. When there's no emotional intimacy, of course, there's going to be an impact on that physical intimacy. And then lastly, are you prioritizing it? Are you making your bedroom a place for sleep and intimacy? Or do you have kids, pets, and tons of clutter or technology there that, of course, is going to put a damper on your mood? So now that you have an idea of some of the things that contribute to your low libido in perimenopause, let's talk about some things that you can do about it. So of course, you're not going to be able to change all of this overnight. I'm not naive in thinking that. But in my opinion, one of the easiest things to, of course, fix is your food, right? And your lifestyle. When it comes to your food or diet, especially, you want to make sure that you have balanced blood sugar, because if not, that's going to affect your cortisol as well. So it's a double whammy. Go back to previous episodes. I talk about the perimenopause diet that I recommend. Really important that you listen to that and you start to implement what I suggest. The next thing is I talked about circadian rhythm. You do want to start to reset that. And this is going to take some time. Because your body is used to doing the opposite, right? So that means getting morning light. First thing, when you wake up in the morning, don't reach for your phone. Go outside, have a cup of matcha or tea or water and sit outside. Go for a walk, whatever it is to get that natural light into your eyeballs. You don't want to be going on your computer or watching TV early in the morning. So many of us are overexposed to this artificial light, and this is really going to confuse your circadian rhythm. So really think about how can you follow the rhythm of the sun. As the sun is starting to rise, get up, go outside, get outside as often as possible. But as the sun starts to set at night, you also want to start to minimize the artificial light. You want to be more in darkness, minimize the technology, and really start to shut down just like the sun. Of course, you want to be making time for self-care and things that are going to help mitigate the stress in your life. And I get it. We all have a lot of stress in our lives, myself included. But if you are always tense, if you're stressed out, if you have a really negative mindset, of course, you're not going to be in the mood for intimacy. So many women and even men are in fight or flight. And when that's happening, when we're always doing, people pleasing, not learning how to relax and make time for self-care, our body is again going to be in that state of fight or flight. So, a lot of women, of course, they're putting others before themselves and they're not paying attention to their own needs and even pleasure. Right? Your pleasure gets put on the back burner. So, can you incorporate things like daily walks outside, deep breathing, yoga, meditation, things that are really calming to the body? You can't give to others or your partner if you're not giving to yourself. And that brings me to, do you even know how to experience pleasure? Have you experimented alone to get to know your body? Learn what turns you on or off. If you don't know, how can your partner know, or how can you expect your partner to know? They're not mind readers, right? So you really do need to learn how to communicate your needs. And I know this can be really uncomfortable if you're more reserved, but if you want things to change, if you want things to improve, you need to put the effort in and be open-minded. And if you're feeling disconnected from your partner, ask yourself why. Are you both working too much? Are you spending too much time on your phones or technology? Are you letting family or other people get too involved in your relationship? Do you both struggle with boundaries and saying no to people who are, taking your time and energy away from your partner? Your relationship is between you and that person, nobody else. So make time for it. And, when it comes to sex, try not to put so much pressure on penetrative sex, right? There's a lot that you can do and a lot of fun that you can have if you're open-minded and you start to communicate with your partner and be willing to experiment a bit in order to build a deeper connection. And then also think about your bedroom environment. Is it relaxing? Do you have low lighting, nice bedding, pillows, silky sheets, non-toxic candles, maybe calming music? Make it romantic, make it inviting. And then obviously you want to address the hormone imbalances that I mentioned at the beginning, right? That elevated cortisol, the low progesterone, testosterone, and estrogen. If you've been listening and following along, you know that I am a big fan of hormone replacement therapy, including replacing thyroid hormones that may be low. It's really important that you consider this in this stage of life to not only mitigate some of these symptoms that you're experiencing, like low libido, but also to set yourself up for healthy aging and reduce your risk of chronic diseases that unfortunately are very prevalent in this stage of life and with the loss of hormones. So some other things to consider. When it comes to your food, I want you to think about experimenting with phytoestrogen foods. So these are compounds that are found in plant foods, and they have a very similar structure to estrogen. So they bind to our hormone receptors in the body, and they have a weak estrogenic effect. So that can make them very beneficial for the erratic estrogen fluctuations that are happening in perimenopause, and of course the symptoms that come with it. So some phytoestrogenic foods are organic soy, things like tofu, miso, tempeh, edamame, and then also things like legumes, beans, flax seeds, pumpkin seeds, and other seeds. And then if you're dealing with any sort of vaginal dryness or pain with intercourse, which a lot of women do, consider using a quality lube, okay? That's going to make things much more comfortable. There are some with hyaluronic acid, and that's going to help keep the vaginal tissue really hydrated. In my opinion, lube makes everything better, so I will link to a couple of different brands in the show notes for you to check out. And then you also may want to consider some creams that have low dose hormones like DHEA or estriol in them, which also support the tissue as well as the sensation down there. So two brands that you may want to check out are Bezwecken. They're little ovals that you insert vaginally, and they come in a variety of different formulas, some with hormones, some without. And then there's also something called Julva Cream with DHEA from Dr. Anna Kabeka, also known as the girlfriend doctor. Again, I'll link to the stuff in the show notes. And then just a couple of supplements to consider. There's something called Ristella by a company named Bonafide. And then also consider nitric oxide. That's going to help support healthy blood flow. It's going to help support heart function, blood pressure, oxygen delivery, and it can help with an appropriate arousal response and healthy sexual function in both men and women. Lastly, if you are open and you like to experiment, consider trying CBD gummies. So CBD is going to help you relax, and there are some specific gummies out there that have herbs in them, like maca, ashwagandha, or horny goat weed to support libido. So a couple of brands that you may want to check out are Via Hemp, VIIA Hemp, and House of Wise. They both have lots of fun stuff on their website, so check those out. So as you can see, there are a lot of different things that contribute to libido, and a lot of things that you can start to put into place to ramp up that libido. So if you're looking for more support, of course, consider working with me and my team in the Hormone Rescue program. And if you want a crash course on HRT, hormone replacement therapy, be on the lookout because I have a brand new course coming out called Perimenopause HRT Roadmap, which I think you are going to love. That is coming in November. All right, as always, I will link to any of the products that I mentioned in the show notes, and I will see you next time. Hey, before you go, if you want to know the 10 things that I do every day to improve my energy, mood, and maintain a healthy weight in perimenopause, grab my free resource, Perimenopause Daily Checklist, via the link in the show notes. You'll learn my daily morning and evening rituals, how I reduce overwhelm and get stuff done, how to structure meals to feel good, and much more. Perimenopause doesn't have to be such a struggle. Let's flip the script so you can feel and look your best. The information provided is for educational and informational purposes only. I am not, nor do I act as a doctor or any other medical professional. I am not providing healthcare, medical services, or attempting to diagnose, treat, prevent, or cure any physical, mental, or emotional disease or condition. The information shared is not intended to be a substitute for the professional medical advice provided by your own medical or mental health provider.